Hey guys, I am here with Dr. Sai. He is going to be performing the explant surgery, and I wanted to take the opportunity to ask you a ton of questions. And
that's what I'm here for.
Yeah, so
we want to educate you guys and give you guys the correct information. Obviously, going online, looking at Google, there's many different, information out there, especially with what's going on here with Nat.
I have had one capsulectomy prior. I had, what is it called? A hemangioma?
Hematoma.
Hematoma, which we'll get into that later. And then now I have a capsular contracture on my left breast. And I've had terrible symptoms. I would love for you to explain to people what breast implant illness is, or what. Yeah.
Exactly. So, just to clarify things, what Nat is experiencing here are two different things, okay? So she has what we call a capsular contracture, which we'll talk about in a second, but at the same time, she's having a lot of these non-specific symptoms that are suggestive of something called breast implant illness. So we have two issues going on. Breast implant illness is, long story short, almost an autoimmune kind of reaction that your body is having to itself, okay? Obviously, as you know, just to take a step back, implants, the most common ones these days are these gummy bear or silicone implants. But regardless of using silicone or saline, the outer shell is still silicone. So you are being exposed to silicone regardless, even if the inside is saline or water, okay? It's just a different shell. It's like an M&M. I like to say it's like an M&M. The candy coat is exactly the same. It's just what's inside, right? Yeah. And so anytime you put a foreign material inside of your body, you don't know how your body's going to react, okay? And so breast implant illness, like I said, is basically your body reacting to it and causing these autoimmune non-specific issues. So your body's kind of somewhat fighting it, low-key fighting it.
Yeah.
Okay. And so some of the symptoms that you have, fatigue, muscle pain, joint pains, tiredness, hair loss even, some endocrine issues, hormone imbalance, sweating, dryness, a lot of different, again, non-specific issues that patients kind of talk about. And again, it's lumped into what we call breast implant illness. Nobody really knows exactly if this is breast implant illness, or are we getting older, or it's the diet, or what we're exposed to. So many factors. The good news is, again, looking at some of the numbers, about 90% of the patients who do have breast implant illness, within about 3 months, they feel significantly better.
When they remove them.
When they remove them, when the implants are removed. So.
Oh, yay.
So this is what we're here for today.
And so I want to give you a little bit of the symptoms that I've experienced. And so I got them done when I was 18. So from the moment I got them done, I don't even think that my body was fully developed yet. I think that I just got into a car accident. I saw that one breast was not growing and the other one was developing. And I think that because of the trauma from the car accident, something happened to be able to stop the growth, or from something happened. And I went to a doctor and they did confirm that there was a breastplate or something that was injured.
Damaged,
Yeah, so immediately after I got my first implants, I got the hematoma. And I had to be rushed to the doctor at 4 o'clock in the morning, and he literally took a scalpel, cut around my nipple, and drained it was like a Dexter scene.
So for those of you who don't know what a hematoma is, what she's referring to is not oftentimes, it's a very rare complication, but what can happen after any surgery is what we call a hematoma. That is when blood collects. When you cut into anything, obviously there's bleeding, right? And if it's not controlled, or maybe the blood pressure wasn't controlled during anesthesia, or maybe it wasn't, cauterized well during surgery, what can happen is after surgery, the artery bleeds, and it bleeds, and it bleeds, and it bleeds on the inside.
It was doing that.
And so the blood collects inside the pocket, and you're going to have to drain it. Exactly.
Oh my goodness, when I tell you that it was the size of a mini watermelon, it really was that big, and I was in the most excruciating pain I've ever experienced.
Very tender, black and blue.
It didn't look real. I mean, obviously it was fake, but it didn't look normal. So of course I ran over to the hospital, and he instructed me to take 6 Vicodin. Not in any way trying to incriminate the man. I know he was just trying to help. And the process of that was just terrifying, and I should have known from that moment on that I was going to have complications. My body telling me, this is not for you. And so down the line, my boobs are about this big. My implant was 500 cc's, 4-something cc's. This is probably way bigger, right?
Yeah, so that's an 800.
Oh, this is an 800. Well, it felt like that. And then back pain. There was, I was always tired. I always had migraines. I always had stiff neck. I had like joint pains in my armpits, like just weird pains, just almost like always shooting up. I was always sleepy. I was always just like kind of like weird with like my period. My skin would go through these random like phases of like breaking out. And I don't really ever had that, or I didn't have that before. So anyway, I ended up developing a capsular contracture, which maybe now you can tell them what it is.
Yeah. So did you get that on the
right?
On the right breast? Okay. So a capsular contracture, which is the second issue we're dealing with here today, is basically the scar tissue that grows around an implant. So anytime you put a foreign material inside your body, such as, obviously silicone is man-made, it's not anything that's naturally produced in our body or naturally produced in nature. The way our body reacts is to wall it off. But the question is, the pathology here is, does it turn into a contracture? And so a capsular contracture means that scar tissue that's grown around the implant over time, as scar tissue thickens, it can get tighter and tighter and tighter. And what happens is it squeezes over time. There's 4 different levels of it, and it slowly works its way up. But long story short, what happens over time is it can get very tight. It can get displaced. So what you see is this displacement. So one implant is higher, it's tighter, it's fuller. The good news is it's not going to harm you as far as your health is concerned. You can still live with it. In fact, I had a recent patient, I did her breast augmentation, and she liked it so much, her mom came in, and her mom was like, listen, I've had these implants in for so long. I've had these capsular contractures for 30 years.
Oh my gosh.
She's had a capsular contracture for 30 years.
She's just living with it.
And she just, she was okay with it. It didn't harm her life. She was like, you know what, I just don't know if I want to do surgery. She's obviously a little bit older now. She's like, I don't know if I want to go through surgery and have to go through the risk of anesthesia and this and that. And she lived with them. And so you can live with the capsular contracture. The issue here is 2 things. Number 1, it obviously doesn't look good, right? Because one's sitting like it normally should be, the other one's tight and high, it obviously doesn't look good. Secondarily, when it's very hard and tight, you have limitation in range of motion, especially for those who like to work out a lot, right? You work out your arms, your shoulders, your back. Imagine something tight on your chest. You're not going to be able to move it like you normally would. And sometimes that can affect some of your more active activities and so on. So those are the 2 things that affect you, appearance and some functionality and discomfort and the tightness and fullness. So
I had that on my right breast, and then I had I started developing the back pain because of the lack of range of motion, the tightness. I had really bad back pain, and then I started feeling the same thing happen to the left, where I could tell it was starting to get harder. And I did everything, like the oil massages. I did the most to try and do, to get them to be soft. And then now you can notice in bikinis, and at the time I'm modeling a lot. One of them is like hard and almost took like a position of like a diamond. It wasn't a circle. It was weird. So you could tell in certain photos and in shirts, and it was really just another thing that I was more self-conscious about. Even like you were self-conscious without boobs, and now you have them, and now you have an awkward shape and weird So I decided to get the capsular contracture handled, and I went with a smaller size. This was the second time that I went under, and I did the whole thing to what I thought was correct the issue. Then I got pregnant, and my boobs were like massive, there's milk happening, there's all these things happening. And after I gave birth to my son, I immediately had breastfeeding issues, complications. I had mastitis several times on my right breast. And then I was told by a lactation consultant that I was unable to breastfeed because of a lot of either trauma or scar tissue blocking the milk ducts from being able to express the milk. I'm not saying it's the implant's fault. I am saying that it didn't help, that I'm now having a capsular contracture. This word is going to kill me. Developing on my left breast, and already on my, probably a small one on my right, but on my left. And it was super hard, very uncomfortable. I mean, I'm leaving out a million symptoms and feelings that I had, but it really made my breastfeeding experience terrible. And I developed postpartum depression, and I went through a ton of that, but that's another story. To get back onto the breast issues, after just that, and just realizing that I do have a foreign object in my body that is now prohibiting me from being able to do something that a mother is supposed to be able to do, I developed not only like resentment and hate towards them, but I also started to do a lot of research and realize that what they've been doing to me for so long, I didn't realize that it was attributed to the breast implants because I got so used to it. Breast implants are just not for me, and even though there's going to be a lot of issues and probably like a weird shock that I'm going to experience with like a completely different body, like who knows what is going to happen here. I think it's just like time to allow my body to heal.
You know, we're here to move forward and get you to the next phase of your life, make you feel better, you know, get on with your life and so on and so forth. You have a brand new life, now you have a family.
And it's different. Family. Okay, let's go into my questionnaire because I wrote it down. Okay. So how many explant surgeries have you performed? And then what is the most common reason to why they want?
I would say the most, you know, at least in my practice, the number one reason for explants, to be honest with you, is a lot of older patients, in their 60s, 70s maybe, and they're kind of, again, going into another stage of their lives. And they just don't want the large implants in place. They want to travel. They want to play some sports. They want to go out. They're retiring, like more like the retirement age. And they feel like it's kind of getting in the way, and they just want to get them explanted and move on. But the second reason is basically just exactly like yourself, where now we have issues. And in fact, I just did an explant a couple of days ago.
Oh my gosh.
Not for breast implant illness, but for just same thing, recurrent capsular contracture.
Yeah.
And so it got to the point to where she was like, you know what, it's time. Just like you were saying, my body's just not reacting very well to these implants, and it's time just to get them out, let them heal, and kind of come back and fight another day. So that's kind of, you know, another big reason. And again, as the years progress, as the because breast implant illness, to be honest with you, isn't something that that wasn't even a term 10 years ago.
Right.
That wasn't even a term maybe 5 years ago. I would be bold to say maybe what's within the last 5 years where it's like, okay, well, something's going on, and doctors are doing more research and things like that. But 10 years ago, never would have heard the thing.
I mean, I wonder if it has anything to do with, you know, how often are you supposed to replace these? 10, 15 years?
So that's the other thing. As technology improves, some of these things, the recommendations are different. So back in the day, yes, they would say every 10 years or so you should replace them. Nowadays, honestly, my personal opinion is unless you have an issue with them, there's no point in going in and doing it again, because every time you go in, you're opening yourself for risk factors of capsular contracture, infection, and things like that. So unless there's an issue to do it, whether you have a capsular contracture, or let's say you breastfed, or now let's say the breasts have drooped over time and you need a breast lift, if there's an reason other than just to replace them to go in, then I would say yes, you can replace them. But just to go in and replace them, I don't think it's necessary.
Okay. Well, that's interesting too, because like nowadays there's like so many, you know, there's been recalls, there's been all sorts of stuff, but there's also improvements in the implants. So when I did it, I was 18. How old am I now? I don't know, 31, 32? So you do the math. It was a long time ago, and it was still kind of like a popular thing. It was like a trend to get implants. Everybody was doing it. The people who probably got their implants around the time I did might be thinking or going through the same thing, because it might have
it takes time for some of these issues to kind of arise.
Exactly. So there was a point in time where I was wondering if I could be awake during the procedure, because I was like, first, the cost of explants are really pricey. And, you know, going under is the biggest reason, I feel, right? And also capsular contractions take a lot longer time. But you could do it awake.
Yeah. So there's two ways of doing an explant. You know, there's a simpler way, I guess, version, and there's a more complex version. So the simpler version is, you know, you could do it awake. You just numb it up. If there's no capsular contracture, no breast implant illness symptoms, and it's just, like I said, if you're like one of those 60-year-old patients, then you're like, you know, breasts are fine. I just don't want them anymore. Just a very simple explant. You can actually do it awake. You just numb up the incision, make an incision, take the implant out, and close it. Okay, that's the simplest way of doing it.
Sounds so easy.
Sounds so easy, yes. Now, the reason we have to do the more complex way, especially for you, is because, again, we have two issues that we're dealing with. Number one, there's a capsular contracture issue. You don't want to leave all the scar tissue in there. But secondarily, you're having some of these breast implant illness symptoms as well. Okay. The way to take a capsule out, the best analogy that I can think of, it's like taking an orange peel off an orange, right? It's sometimes a little bit tricky, because if you don't do enough, you leave some of the capsule on, right? And so you leave some of the orange peel on the orange, but if you do too much, then you peel the orange off. You don't want to take the breast tissue out, right?
No, please leave that
Exactly.
there.
And
I
so,
need whatever breast
whatever
tissue
you
is
need.
there.
So again,
Fluff it, make it
make
there,
it more.
make it bigger.
And so, that's the best analogy I can think of. You got to be very precise. It takes a lot longer to do than a breast augmentation. With a breast augmentation, all we're doing is we're opening an incision, creating a space, putting the implant in, and we're done, right? A regular breast augmentation takes less than an hour to do. But when it comes to something like this, where we have to actually scrape the tissue out, this could be a 3-hour procedure. This is exactly, so it's a lot more involved because you want to be meticulous. You want to make sure you're not cutting out breast tissue. But at the same time, you also want to make sure you're cutting out enough of the capsule. Because again, the capsule and the breast tissue are pretty much like glued together, just like an orange peel and an orange. There's a layer there, but you got to be very careful not to, again, take out breast tissue, but also take out the capsule. So
Does it look different? Does the cap?
It does. It looks very
different.
different.
What does the breast tissue look like? Just out of curiosity.
The breast tissue looks almost like fatty tissue.
Okay.
So it's yellow, it's like lobules, and you can definitely tell the difference between the breast tissue and the capsule. The capsule's more like a rim of shiny scar tissue that you can kind of, tell the difference between. So.
Okay. Oh, you guys, I'm so nervous because I'm like, I don't know. I can't even remember. That's how long it's been. I can't remember what my body looked like before implants. I can't. I don't even have photos, I think.
Oftentimes in a procedure like this, and I believe we might have discussed this as well early on, is in order to kind of recreate some of that volume, oftentimes what you can do is something called fat grafting. So we could do liposuction to the stomach, the flanks, the thighs, the arms, wherever, take that fat, inject it to the breast, so it's not like going from 100 to 0, it's maybe 100 to maybe 20 or 30, so you at least have something. But
yeah, that's awesome to learn about. I mean, there's so many options these days. I think for me, I know that there's even like bras that have like boobies in them. So whatever, like I'm already engaged and I already have a family and my fiance's gonna love me no matter what, so we're fine. And maybe I will buy those little chicken cutlet looking things. And then I did have, so before being able to do the procedure, there's a lot of people who don't know a lot of like the pre-op orders and the instructions. And
another consultation, you come in, we chat, and we kind of discuss a plan and everything like that. And then once we decide to proceed, we have you come back once again. We review the procedure and everything one more time. We talk about all the risks, benefits, alternatives for the procedure. There's obviously a lot of paperwork and things that need to go through it. But we also send you out to get your lab work done, whether you can get it done by yourself through a PCP or we have offices that we can send you to. They'll draw your lab. They'll take a urine sample. They want to make sure everything is good, right? We want to make sure, because again, this is an elective procedure. This is something that's, like I was mentioning, doesn't have to be done, but we want to make sure that your health is optimized before we go through surgery because 100%. You want to make sure you heal well. We don't want to have complications, infections, things like that. So if your health is optimized, then you're going to heal the best, right? And so by looking at your labs, we're able to see how healthy you are on the inside.
And so post-op, this is like my biggest thing. So this is why I put off doing this for so long because I had to make it make sense. The healing time or recovery time is estimated 2 weeks. About
a week or so. Good thing about your situation is we're not replacing it with a new implant, okay? I do a lot of what we call replacements, okay? So although I don't do quite as much full explants, I do a ton of replacements. So a lot of patients will come in with capsular contracture or some of these issues. They'll get it out, but they also want the replacement of an implant. So I do a ton of those. And so you have to be more careful with the patients who you're putting a brand new implant in because now we want to make sure you don't get yet another capsular contracture, right? Which is what you went through. So, the post-operative instructions and kind of what you have to go through are a bit more sensitive afterwards because you want to prevent that. Now, in a situation like yours, because we're not replacing an implant, we don't have to worry about capsular contraction. We don't have to worry about breast implant illness. We don't have to worry about some of these other things. Right. So getting back to your life and getting back to activities will be a bit quicker and easier for you.
Thank God. Yeah, because I was like, oh my goodness, like Mo's going to be home for 2 weeks watching Edrius, who is in this toddler. I call him my little drunk human because he's just all over the place and he is super attached to me. So I'm just like nervous that he's going to want to like jump on me or like want me to pick him up and I'm not going to be able to do that. So.
Well, in a situation here today, I'm again more inclined to let you do some of these things. Again, first couple of days, everything's very sore. Your body's gonna tell you, oh my gosh,
Yeah,
like,
I'd be like, no.
no, exactly.
No, don't tell them that. Let me sleep.
Yeah, it's gonna be a month. I'm just kidding.
Right?
But because we're not replacing an implant, because we're not worried about capsular contracture, the biggest thing here that we're worried about, again, is probably hematoma, right? Because we're cutting the tissue out. We want to make sure there's not a lot of bleeding. We'll be putting drains in this time just to make sure you don't have, that fluid buildup. But once the drains come out, once you've gone through the first maybe week or so, the blood vessels have closed up, I think you're pretty much safe to go from there. You just might be a little bit more tender.
Okay.
But there's nothing that we have to necessarily worry about because there's no new implant in there.
Yeah. And that's like one of the things is like every time, well, the one time I got them replaced, or when I got them and when I got them replaced, they both times had capsular contractures. So there's all that. These are the smallest size. Mm-hmm. Which I wonder what that looks like.
That's 170 cc's.
That's still so wild to me.
This is an 800, so it's a very, very, very big difference here.
This is the size I swear to you that it was when I got the hematoma.
And I think this is what you are now, if I remember, if we have the size correct.
But if you look, it's weird because, well, they're both not the same size anymore, and there's a massive gap, which we'll show before and afters. Very invasive, but I'm down to show for the study.
For the study?
For the study and the purpose of making you feel confident in your decision to get an explant. They're very far apart. Remember you mentioned that, and then one of them is like all the way in my armpit, and the other one's like kind of drooping down, but my nipple's like depressed and facing down. It's a horrible situation, you guys. So I'm so excited, and thank you for answering all the questions.
Of course, my pleasure.
And of course, you guys can leave questions or any kind of like feedback that you guys have or whatever you want to ask Dr. Sai in the comments. He's really good at answering them, and he goes live often as well on his page. If you want to give him your handle. So that
it's drrogertsaI, it's just my name, drrogertsaI.
Awesome. Thank you.
My pleasure. I'm excited and looking forward to your procedure.
And treat me right. Do all the
I got
things.
you.
Make sure my boobs are still like something there. I don't even need a lot. Just like a little something. Be very careful.
Absolutely.
I trust you. No, I trust you. I really do trust you, and I'm excited. Thank you.
I'm excited too. Can't wait.
Let's do it. We should just like smack the camera with an implant, and that's like the cut too. Awesome.